This will be a short video discussion about antivenom for North American snake envenomation. And the main reason this will be short is that we're only going to consider pit vipers. This content corresponds to Antidotes in Depth Chapter A39 in Goldfrank's Toxicologic Emergencies. The learning objectives for this session are that you'll be able to identify the kind of antibody fragments found in the two pit viper antivenoms that are currently commercially available in the United States, and to outline the dosing regimens for these products. Two antibody fragment products are currently available in the US to treat pit viper envenomation. The older and more frequently used product is Crofab, and the newer product is Antivip. Crofab is an ovine product being derived from sheep antibodies, while Antivip is equine, from horses. The other difference between the products is that Crofab is a Fab antibody fragment, while Antivip is Fab2. In manufacturing both products, the whole IgG antibodies are cleaved enzymatically to remove the Fc portion, thereby reducing the risk of a biologic product causing an allergic reaction in the patient recipient. With Crofab, the cleavage is with papain, which produces 2 Fab fragments per IgG. And for Antivip, the cleavage is by pepsin, producing a Fab2 fragment, which has 2 venom binding sites per molecule and a different size and molecular weight, probably accounting for some of the pharmacokinetic differences between it and Crofab. Both of the products are lyophilized, or freeze-dried, and come in glass vials, and they need to be reconstituted with saline for administration. According to the instructions for both products, you start with a 250 milliliter bag of normal saline, and fill each vial using a needle and syringe with a prescribed amount of saline to dissolve the product. The vials can be gently swirled or turned upside down and then back upright again repeatedly to help suspend the product, but you don't shake them since that can result in foaming or even denaturation of the antibody fragments. Then you draw the reconstituted antivenom back into the syringe and then inject it back into the original saline bag. So you end up with all of the antivenom dose dissolved in 250 ml of saline. Crofab is dosed in aliquots of 4 to 6 vials, which then gets repeated until initial control is achieved. Initial control means that the progressive pain and swelling has halted, any hematologic lab abnormalities have reversed or are at least headed in the right direction, and other systemic toxic effects are halted or reversed. For severe envenomation, the initial dose could be increased up to 12 vials if necessary. And if the first dose doesn't achieve initial control, you give another dose of 4 to 6 vials, and so on. But then once initial control is achieved, there is maintenance dosing of 2 vials every 6 hours for 3 more doses. Something noted early on with Crofab is that there is the possibility of what's called recurrence phenomena, where some envenomation effects would come back after initially going away, and this was particularly noted with thrombocytopenia, a low platelet count. The 3 maintenance doses after initial control are thought to decrease the likelihood of recurrence phenomena, which might result from differences in the pharmacokinetics of venom components versus the antivenom. When antivenom therapy is initiated, you start at a low rate, between 25 to 50 ml per hour, and you monitor the patient carefully looking for signs of an allergic reaction. If the patient tolerates this slower rate, you then start cranking up the infusion rate until you get up to 250 ml per hour. That way, the 250 milliliter bag will be infused in just over an hour's time. Antivip dosing has some similarities to Crofab and some differences. Antivip is given in doses of 10 vials, and these doses are also repeated until initial control is achieved. But once we have initial control, there are no scheduled maintenance doses. And the lack of need for maintenance doses is likely related to the fact that Fab2 fragments have different pharmacokinetics compared to Fab. However, if signs, symptoms, or lab abnormalities return during an 18-hour observation period, the redosing dose of Antivip is 4 vials. And here's a nice summary of pit viper antivenoms that was created by a PharmD who posted this photograph on Twitter. Feel free to stop the video here to take a closer look if you want. That's all for this video on North American pit viper antivenoms. I'll be seeing you around.